Hi there, Rob from InjuryFitPro.com. This is part of my back pain decoded series, and in this video, if you've been told that you need facet joint injections, I'm going to give you 5 things that I think you should know about or should be asking the doctor administrating those injections before you have them. Okay, so first up, what are the different things that can be injected or commonly injected into a facet joint? Here's a facet joint. I'll come into how exactly it's injected later on, but first of all, let's go through what's injected. So, the most common one is local anaesthetic. That's usually always included in a facet, or sometimes pronounced Facet if you're in the US. Now, the other thing could be steroids, so corticosteroids typically, and other options are things like prolotherapy, so that's could be dextrose combined with other chemicals such as glycerol and phenol. Now, I haven't really got a problem certainly with dextrose only prolotherapy, but my beef really is with the over-injecting steroids into a facet, and that's what I'm going to concentrate on this video. Number 2, how exactly are the injections going to be performed? The clinician will need to use some sort of image guidance in order to get the needle tip exactly into the right place in the spine in order to avoid damaging other structures. Most commonly this is going to involve some sort of x-ray, so either fluoroscopy or CT guided injections. Out of the two, CT guidance is arguably a little bit more accurate in terms of getting the needle tip exactly perhaps where it's needed, especially if it's inside the joint. But it's important to realise that both of these methods do involve at least some exposure to an amount of radiation. An alternative method may be ultrasound guidance, which obviously doesn't involve any radiation. This is perhaps a little bit less common, but it will also need to be usually done following either a CT scan or an MRI scan, so that those images from the MRI and CT can be correlated at the time of the ultrasound scan. Side effects. Are there any side effects to medication? Okay, so local anaesthetic, not really, as the name suggests. It gives you some local lasting painkiller, pain relief for maybe a few hours perhaps. Not really too many side effects. I mean, there is some evidence out there to suggest that maybe it kind of stops actions with other chemicals such as PRP, so regenerative medicine sometimes is done without the local anaesthetic because they worry about could it impact and stop things like stem cells working, stop the regenerative process. But largely it's probably, in the context of a facet joint injection, that's perfectly kind of acceptable, I would say. Now, prolotherapy, I've mentioned before, dextrose, it's a sugar, really it occurs in your body, it's quite a natural produced chemical. That actually is designed, if anything, to sometimes be anti-inflammatory, reduce the overall levels of inflammation eventually, and help the body to kind of stiffen a little bit and tighten up some of the ligaments. Again, not really got too much of a problem with that. Steroids, however, steroid injections, now a steroid chemical is a very, very powerful chemical, okay? So corticosteroid has a large anti-inflammatory effect. Yes, it will get rid of the inflammation, most likely. Yes, it will get rid of the pain, but what are the downsides? The downsides are, if you're injecting into, I'm going to come on to whether it's into or onto later on, a facet joint injection, really, it's questionable how many times you want that done, because steroid has been shown to be damaging to cartilage surfaces, and if it's done in tendons, there's cases of tendons that can be broken and can rupture as a result of a steroid injection. Similarly, it's not very nutritive to the cartilage surfaces of a facet joint, so it could actually accelerate the amount of wear and tear, and could, in my opinion, could potentially even accelerate the chances of osteoarthritis forming in that joint. So that's the main issue, really, and that's the main side effect. As comes with all injections, there are some side effects or risks, let's say, of infection, but usually that's pretty minor and doesn't normally occur, but these are the things you need to be aware of. Now, I would say you need to know I would be asking certainly whether the facet joint injection or injections is going to be into the joint, which is called intra-capsular injections, or onto the joint, which is called an extra-capsular injection. Now, I can tell you for a fact that some pain doctors will only do the extra-capsular injections just onto the surface of the joint, because they'll say the evidence shows that it's just as effective going into the joint. However, I'll be honest with you, I've got concerns that really is actually because they can just get more injections done in per unit amount of time. And the discussions that I've had with some of the top radiologists, certainly in London, would indicate, and their preference is that if you've got a diseased facet joint, if it's very arthritic, really, the cartilage surfaces have worn, you want to get that injection into the joint to have the maximum chance of pain relief. And I kind of go with that idea, particularly if you've got, as I said, an arthritic facet joint. If on the other hand the facet's relatively healthy, there's not too much cartilage wear and tear, then yes, I can see that maybe going onto the surface of the joint, the extracapsular injections maybe are the better option in terms of less likelihood of producing wear and accelerated degeneration within the joint. Now, how many facet joints are they going to inject? Okay, now I've had examples of colleagues of mine, including myself. We might refer for one facet joint injection. We're pretty convinced that, let's say the patient's got an L4-5 facet joint is where their pain is coming from, that hasn't responded to manual therapy, and really wants an injection just on that joint to really help them along. And then the patient ends up having about 4 or 5 facet joint injections. If they're self-paying, then the fee is about 4 times what they were expecting to receive. And if it's insured, well, fair enough, the insurance company's footing the bill, but again, the premiums are going up because the pain doctor or the surgeons ended up injecting 4, even more facet joints, two below, 2 above, where the pain is. So, and that's also not that really helpful for a diagnostic point of view, because then you don't really know whether was it that facet joint, was it one above, was it one below? If that patient needs to have that repeated again, do they have all 4 joints done? My preference really is to have a clear single level isolated facet joint. If the workup's been done correctly and the clinical signs are pointing to that one individual facet joint, if you've got MRI findings and maybe an X-ray findings to show that that joint's worn, has got some inflammation around it, that to me logically is where that joint should be injected, and just that one joint alone. So there we go. Hope you enjoyed that one. Hope you found it useful. Hope you found it informative. Really, the take-home messages there on that video are, look at the options. Okay, so have you exhausted all the lines of different forms of treatment before you go for facet joint injections? Find out exactly, is that joint injection going to be intracapsular or extracapsular? Find out exactly how many joint injections the clinician is proposing to do. Is it just 1 facet? Is it 2? Is it more? I've known patients have up to 7 injections. Finally, if you liked the video, please subscribe to my channel, click on the links below, give me a thumbs up, let me know your comments. You can also check out my book if you want to have a read of more things and more options and go into a bit more depth than covered in this video in terms of what the options are for low back pain, from scans to exercises to therapy and even surgery and the injections. That's over at injuryfitpro.com. It's also available on Amazon. I'll put some links below. Thanks for watching.